Good afternoon. My name is Leah Wanaswa from ICFP 2025, here to share our Tiko experience regarding our World First Adolescent Sexual and Reproductive Health Development Impact Bond. Tiko is a non-profit that works across 7 countries in Sub-Saharan Africa, focusing on vulnerable adolescent girls 15 to 24 years, especially dealing with the triple threat around issues of early pregnancy, HIV and AIDS, and sexual and gender-based violence. We do this by addressing their 3 key barriers, which is around issues around awareness, accessibility, and affordability. And we do this through a tech-enabled digital platform that connects demand generation actors within our communities to service providers. These service providers include both public and private sector service providers that are youth-centered and are able to provide services that are youth-friendly. And so in regards to the Development Impact Bond, we implemented this in Kenya, operating in 10 counties. To just explain how a development impact bond works, in a development impact bond, we have outcome payers, and these outcome payers pull in their resources to be able to support the implementation. And actually, the pulled in resources are able to be paid out when the outcomes are fulfilled, and this must be verified by an external evaluator. We also have the social investors, and the social investor is the one who actually gives the working capital to the implementer. These are also paid back when the outcomes are fulfilled. Once the external evaluator has been able to ascertain that the results are actually verifiable, the social investor is able to pay out this amount. Then we have the implementers. The implementers are the ones who actually deliver on the strategies. They deliver on the actual strategies that enable the outcomes to be achieved. And so in regard to the development impact bond that we implemented in Kenya, we had the outcome payers who included SIF, the SGBV Partnership, and the UN agencies, which were UNFPA and UNAIDS. For the social investor, we had the Bridges Outcome Partners, who are the ones who gave the working capital. And for the implementer, we had Tiko. In regard to the implementation, we worked in 10 counties with the Ministry of Health within those 10 counties, implementing with 42 community-based organizations and 380 facilities. These 380 facilities included both public and private sector. The 42 community-based organizations worked with about 3,900 mobilizers who created awareness within these communities. So the focus of this development impact bond was integrating family planning and HIV and AIDS programming. And so we were able to have as the the outcomes 5 payment metrics, and 2 of them looked at service delivery, so around 2 number of services given to adolescent girls for family planning, and the number of girls taking HIV services. We also had 2 payment metrics that specifically looked at adherence or continuation to services, both for HIV services and family planning. And the last payment metric was around the multidimensional poverty, to ensure that as Tiko we remained true to our vision. And so it was looking at the proportion of girls who were within the multidimensional poverty, and we used the multidimensional poverty index to be able to do this measurement. Therefore, what we were able to do differently in this development impact bond compared to our previous grants was, 1, we had the working capital that enabled us create an enabling environment across these counties where we were implementing. It enabled us set up structures and systems. Us also ensure that each of the actors we were working with had a performance-based management contract that ensured that they remained accountable to the girls that they were going to serve within those communities. The other aspect was in regards to the implementation and design of the interventions. We were able to maintain agility as an organization, iterating as we responded to the needs and feedback that we collected from the girls when they came in for the services. And so through client exit interviews, through rating scores that they were able to provide on the platform, we were able to collect this feedback and use that to inform the additional trainings that the service providers needed, use that to inform changes that we made on the platform to ensure that all through there was a seamless user journey that the girls experienced as they came for the services. In addition to this, we were able to actually achieve in regards to our performance on the platform. We also had the aspect around repayment to the outcome, to the social investor that was included because of the aspect around the investor receiving payment because of the achievement of the results. And so a lot of learnings have been done, and we actually know that when countries come together and begin investing in blended financing, such as this one in the Development Impact Bond, then they begin focusing on outcomes instead of focusing on input. And the advantage of that is because the impact begins becoming visible. In regards to the that were also participating in the intervention, the changes that were made in regards to focusing on actual strategies that actually lead to impact also enable them evolve in their systems, evolve in the processes, and how they actually strategically chose what activities to engage in and which ones to come to an end. And so guidance from this Development Impact Bond to countries that are coming in is that as countries, this is the opportunity that we have to be able to come up with such blended financing mechanisms so that we can be able to take and leverage on the opportunities that are already available in both the private and public sector, leveraging on technology and also on equity to be able to avail these services. So if you're here from South Africa, from Ethiopia, from Kenya, from Uganda, Burkina Faso, we look forward to working with you and partnering with you in this process. Thank you.